So I have this deck of cards here, and I'll be telling a story based on what cards I get in order. Random order. Let's start by shuffling this deck. Alright, let's begin. So I have a 51-year-old male patient coming into the ER saying he is seeing some bizarre thing with this card deck. It seems like he's explaining this card deck that appears and disappears for some reason. I'll show you an example. I have this regular old card deck with this cool case, and you can see that this is just really a normal deck of cards with some cards in it. But for some reason, if I put this card deck back into this card case and with a little snap, you can see that the case is really empty without any card. So it's exactly what this guy is saying. Maybe you're also hallucinating, having some illusional thoughts. But in addition to that, he is also having some disorganized thought. Maybe you can also describe as maybe some circumstantial. And what do you think? Yes, he does have schizophrenia. And when treating schizophrenia, you should think of cariprazine as one of the atypical antipsychotics that was FDA approved in back in 2015. Now let's talk about this other guy. Now he is a 56-year-old male patient, but he has some flight of ideas, and also he's not sleeping much, only running on 3 hours of sleep. But he is also having sex with multiple people, and also he is also having a lot of fun gambling, trying to hit all the jackpots and trying to get all the 777s, but really he's just wasting his money. What do you think? Yes, he is also having some manic episode. He also has a period of being depressed and meeting all the SIG ECAPS criteria. Now here comes cariprazine one more time. Also used to treat bipolar disorder. Get it? Bipolar, bicycle. But now let's talk about some side effects of this cariprazine. There will also be some nausea, vomiting, and dizziness as this king kind of does, and I'll show you exactly what I mean by that. If I get this king and then make it a little bit dizzy, like kind of cariprazine does, let's see. You can see now this king is having some weird thoughts. But now, and as all antipsychotics do, there will also be some extrapyramidal symptoms, such as akathisia, tremors, and muscle contractions, kind of like this 5 of diamonds that you see. So if you look, this 5 of diamonds is perfectly normal, but if it's having some extrapyramidal symptoms, giving some little shake, you can easily see now this 5 of diamonds is not having a great time, having a lot of tremors and tardive dyskinesia and all that stuff. And you think cariprazine will also have some effect in the QT interval, just like the other antipsychotics, Q for the QT, really. But surprisingly, there isn't any QT prolongation with this drug. And remember this queen kind of disappearing with cariprazine and having no QT interval prolongation. Now let's talk about some mechanism of action. Unlike other antipsychotics, which are D2 and 5-HT2A receptor antagonists, cariprazine is surprisingly a D2 and a D3 partial agonist. So in schizophrenia, dopamine receptors are overstimulated. So essentially by being a partial agonist, it is inhibiting the overstimulated dopamine receptors, acting as an antagonist. I will show you what I mean. Think of these 4 aces that over here you see as dopamine activity. And what cariprazine does is it's going to inhibit this dopamine activity. And I'll show you exactly what I mean by that. Look at this ace, or also known as the dopamine activity. With a little snap of cariprazine, you can see that the dopamine activity is no longer to be found. There is no ace. Let's try that one more time. This time, I'm going to put this dopamine activity somewhere in the middle, hiding, but it doesn't matter. With the cariprazine little snap and through the deck, you can see now the dopamine activity is no longer to be found. One more time, let's get this ace of spades, another dopamine activity. But with the little snap of cariprazine, you can see now this dopamine activity is also no longer to be found. And finally, let's get this last ace in the middle of the deck. Again, going in the middle, but with the cariprazine through the tunnel, you can see now the dopamine activity is also just gone. And so I want you to think of cariprazine as a possible drug of choice for maintaining schizophrenia and also bipolar disorder. Usually it takes about 6 weeks for drugs to take effect, but sometimes even with all the medications, it doesn't really work. And I'll show you exactly what I mean. Let's say I have this regular deck of cards, and you can see that it is a normal deck of cards with different cards. But even when you're on Cariprazine, you might be hallucinating just like this. With a little snap, you can see that all cards change to 9 of hearts. Thank you.